We've had so many questions from our patients about the coronavirus, the new coronavirus that's causing the disease called COVID-19. And we've done a presentation to some of our staff to get them updated that we've thought we'd put together this video for our patients and our community members, hopefully as a public service. So what do we know about COVID-19? Well, COVID-19 is caused by the coronavirus. You may have heard of coronavirus before. There are 4 known human coronaviruses that are responsible for about 25% of the common cold each and every year. This is the 5th known human coronavirus, and it's causing a little bit more of a stir than the common cold, as you've undoubtedly heard. It looks like from early genetic analysis that at some point in mid-November in China, that this virus crossed from bats to being able to infect humans. You've heard of this before with swine flu or avian flu. Some viruses start in other animals, and for reasons that are complicated and just starting to be understood, viruses will mutate through the part of normal life cycle and move over into other species, like humans in this case. So what does this virus do? And there's so much misinformation. Just in the course of a few weeks, we've swung from this is no big deal, this is completely exaggerated, to this is going to end the United States as we know it. And one of the things that I hope to help you think through is how hopefully neither of those are true, and it is somewhere in the middle. So what does it do? It causes an illness that primarily presents with cough, fever, shortness of breath. As I'll get to in a moment, it seems to be, it's for sure worse than the common cold. It seems to be a little worse than the flu, and certainly a higher mortality rate. But at its core, it is a respiratory virus that primarily manifests as cough, fever, shortness of breath. The incubation time seems to be about 14 days. There's some evidence it may be even shorter, maybe down to 5 days, we've heard. We're learning so much about this new virus so fast. But there is a period of time where you get the virus, but you don't have symptoms. It does look like this virus spreads by respiratory droplets, not by dust particles or a true airborne virus. It does look like it's respiratory particles, the best evidence we have here on March 18th. The worst case scenarios is that it causes a pneumonia. This is a CAT scan of the lungs, and it's kind of fancified here, but this is isolating a very specific pneumonia that the COVID-19 illness can cause, needing ICU treatment. We don't have antiviral medicines for this virus, and we don't have a vaccine. What we do have is ICU beds and ventilators, as long as everybody doesn't get sick at once. But it does cause a pneumonia, and it does have a mortality rate. So there's been a lot of comparisons between COVID-19 and influenza. And depending on how you draw your graph, the flu can look worse or COVID-19 could look worse. We should not underestimate this virus. We should not overestimate this virus. Unlike the flu, we don't have antivirals. Unlike the flu, we don't have a vaccine. The flu, in the era with a vaccine, the flu kills less than 0.1% of the population, mostly in the elderly. COVID-19 kills a higher percentage of the elderly and of the population at large. It looks like it's going to be somewhere between 0.6% and 3% of the entire population. The flu is around 0.1. So probably the most conservative estimate is that COVID-19 is going to be 6 times more deadly than the flu. It's not worse than that, not better than that. So, if you think about some of the other pandemics that we've had in most of your lifetime, SARS and MERS were also respiratory virus based. We're looking about, these are just cases coming in, we're looking about the same mortality rate. nowhere near what Ebola was, 40%. The H1N1 flu, this is the final numbers from it. We don't know where coronavirus is going to end. This is a New York Times graph from just a few weeks ago. And so it's looking more deadly than the seasonal flu, less deadly than Ebola or smallpox, definitely doesn't spread as fast as measles or chickenpox. You know, measles is a great example of something that's truly airborne, stays in the air for hours, even days, latches onto dust particles. This is truly respiratory droplet, coughs and sneezes and handshakes and high fives and close contact. Okay. So we first heard about this last December. If we were all paying attention, it started in Wuhan, China, and spread throughout China. China has been in the news a lot for their quarantine. They kind of went on lockdown, and they finally got the disease under control with some very aggressive measures. The virus spread to many countries, but Italy is one of the countries it spread to. Italy has a slightly older population, and it hit Italy very fast. And Italy's issue that we're trying to avoid here in America is that everybody got sick at once, and the hospitals ran out of beds, particularly ran out of ICU beds. That's the biggest fear of this virus, is running out of ICU beds, running out of healthcare capacity. We'll get to that in a minute. South Korea, Singapore, South Korea particularly is one of the Asian countries that responded kind of objectively the best. They rapidly deployed widespread drive-through testing and very quickly figured out who had the coronavirus, isolated and quarantined them, and really got control of the virus quickly. They had widespread testing, which has been a big hiccup in our system thus far. There's a great website, the Johns Hopkins coronavirus website, just showing where the cases are, and it's a kind of hour-by-hour updates, how many total confirmed cases we have around the world, how many total deaths, how many have recovered, country by country, and you can see the map. It's super cool. You need a laptop. It's not mobile friendly. Check it out. So how's it transmitted? How can you prevent it? Know how it spreads. I mentioned that it's respiratory droplets. So you cough, you sneeze, you get it on your hands, you share food and glasses, and just it spreads like the common cold does, like influenza does. So what can you do? This virus is not a magical virus. It is killed easily with soap and water. You need to wash your hands for 20 seconds, especially after blowing your nose, coughing, or sneezing. If soap and water aren't readily available, a hand sanitizer not lotion, a hand sanitizer that contains at least 60% alcohol. Try not to touch your eyes, nose, and mouth. These are habits we're all paying more attention to now. Really avoid close contact with people that are sick, and put distance between yourself and other people if COVID-19 is spreading in your community. I'll have more about social distancing in just a minute, but just a reminder, we always knew this was important. It's so important, and it's so effective. Trust the process, it's effective. If you're sick, you need to stay home, except for getting medical care. I'll talk a minute about what Cahaba Medical Care is doing to be ready for sick people coming into our clinics. Cover your mouth and nose with a tissue when you cough or sneeze. Throw the tissues away and immediately wash your hands. If you are sick, you should be wearing a face mask around other people. Your healthcare provider's office should give you a face mask if you're sick. If you're not sick, you do not need to wear a face mask. There's some great examples in Singapore, in an article in the newspaper yesterday. You don't need to wear a face mask if you're sick. Face mask, there's a worldwide shortage of face masks. We need them for sick patients. We need them for healthcare personnel. Clean and disinfect frequently touched surfaces daily, at least daily. Clean your laptops, clean the different things that you touch, your doorknobs, and remember the symptoms. Okay. And also, we're avoiding handshakes. Around here at Cahaba, we've been really trying to change some of our behaviors. We're doing the Red Cross Mike Pence elbow bumps. We're doing namastes and waves. Or my partner, Dr. Smith, says we could also do nothing. How do you diagnose COVID 2019? It's testing. So when you're being tested, the personnel should be in eyewear, respirators, gowns, and gloves, and it is a nasal test, just like the flu test. It's not any different than the flu test if you've been tested for the flu. Now, I want to take a moment to explain the news. What is social distancing? Why should we do it? And if you've heard the term flattening the curve, what is that all about? Everybody's emotions and thoughts have ranged from, this is the dumbest overreaction ever, why are we closing restaurants and schools and sporting events, to complete panic, is this a virus that's going to eat our face off and kill 90% of us if we get it? It's neither. Let me tell you what the social distancing is. This definitely is a pandemic that is a little bit unprecedented. And so the whole issue of flattening the curve and social distancing is all about this graph. I've got more graphs, but this is the key graph. If everyone gets sick at once, and a certain percentage of those people are going to die, and a certain percentage of those people are going to need ICU beds, probably less than 1%, at least less than 3%. But if everybody gets it at once, that 3% of 300 million people is way more than the number of ICU beds that we have. So the urgency of social distancing is to not have everybody get sick this week. You know, if I'm going to get sick, and I probably will, 30% of us are going to get sick. We're going to get this virus. 30 to 50% of us are going to get this cold type, flu type virus that is worse than the flu. We want to get it next week or the week after. We want to get it when some of the early people are starting to recover, so that the healthcare capacity, especially ICU beds, so that we don't run out. Let me kind of show you how that works. Okay, first case in the US was January 22nd. By March 13th, I'm recording this on March 18th. On March 13th, incidentally, the day that Alabama got widespread testing, the US had 2,000 cases in the US. Note that this is before Alabama started testing. I'll come back to that in a moment. So I'm going to show you a great article that came out Saturday in the Washington Post. And we're going to talk about what flattening the curve is like. So let's imagine a hypothetical illness. Okay, these little cute little dots, brown means you're sick and blue means you're healthy. You can see how the sick people started spreading in this little family of 5. They spread the disease. Now, if I go here, purple means they recovered. And so this COVID-19 is behaving like a normal disease that once you get it, you don't get it again. Now, listen, COVID-19 is going to be with us for the long haul. We need to get a vaccine for it. We don't know if it's like measles or tetanus where you need a booster. But what we know is it does not appear that we're getting this back-to-back in the same season. Okay, now let's imagine a city of 200 people. And you can see with movement, this is the restaurants open, sporting events open, Little League, football games, track meets, restaurants, bars, churches. Look how fast everybody got it. Now you do recover. They're not tracking deaths from this. But look at this curve. Pay attention to this curve. Everybody got sick, and they got sick all at once. This is what happens with no social distancing, no precautions. And you can see how rapidly it spreads. And if you imagine the healthcare capacity is halfway through the graph, we have completely overwhelmed, at this time point, we've completely overwhelmed the number of beds that are in Baptist Princeton or UAB Medical West or Bibb Medical Center, the hospitals that we use here at Cahaba. They're completely overwhelmed. We're trying to avoid this. Now, look, one way to avoid this is the December 2019 Chinese-style quarantine. So here is the quarantine right here. The sick people are over here in quarantine, and they're getting everybody sick. They're staying well here. Wait a minute, why'd the quarantine break? Well, life happens. Somebody snuck out of their house, or the milkman came and they got sick. But look, the people in quarantine are now recovered, and now it's spreading through. So even with a imperfect quarantine, look what happened. This is called flattening the curve. So let's say healthcare system capacity was right here. We never quite peaked until later, and we were ready for it. This computer simulation on the Washington Post website, it's random every time, and so you can kind of see it again. It takes a little while for somebody to sneak out, that we've flattened the curve. Now we've had time to prepare. These people are recovered. They're out of the ICU. They're out of the hospital. And a slightly different peak. And I keep talking about ICU beds because that's what's in the news. But I can say, as an ambulatory care family physician, we have a limited capacity at the clinic as well. We can handle at some of our clinics about 150 patients a day. We can't handle 500 a day. We run out of tests. We run out of gloves, and masks are in short supply right now. So it's the importance of flattening the curve. Now let me show you, the United States has not quarantined. We have done social distancing. So watch the dots that are staying still. That's people staying in their houses, but they're not, it's not illegal to go to the grocery store. Or you can still go to Wendy's or Jack's or, wherever. But so it's still spreading. It's still spreading. You're going to get this virus. Many people are. Not everyone, until people start recovering and the virus leaves its season. But look how we flatten the curve and we decrease the peak. Social distancing can work. In this computerized model, this is what if 75% of the population is sitting tight. So the only people that are moving are the essential personnel, firefighters, policemen, people working in the hospitals, people working in community health centers, essential healthcare personnel and other public servants. We flatten the curve and we keep people from getting sick. What if we get really aggressive? Now only 1 in 8 are moving. Look, many more still dots. This is what can happen if you social distance. We significantly flatten the curve. We never have this huge peak of people sick at the same time. And we have much fewer people getting sick all at once. This is what we're after. And as I'll show you now, it really makes a difference for the whole society and for the pure number of people that are getting sick and dying. So this is from a New York Times article this weekend as well. If we did nothing, it's estimated there might be as many as 10 million infections and 1 million deaths in the United States. But what if we waited around until we really got 5,000 cases, until if we didn't overreact and said, okay, well, let's wait till school's over and let's shut things down. Well, we might cut it in half, cut the deaths in half. What if we delayed until July? Well, this might, just barely make a dent. What we've tried to do, what the Trump administration, what Governor Ivey's administration, what the Mayor Woodfin and the Alabama Department of Public Health is trying to do with this social distancing, closing restaurants, closing schools, asking churches not to gather, is to really reduce the number of people infected all at once and reduce the total number of deaths, getting people sick people having later in the year, minimizing the peak ICU cases, flattening that curve and pushing it out to fewer ICU cases. That's the real goal. Without protective measures, without social distancing, everybody gets sick at once. With protective measures, we preserve our health system capacity. This is what the game is all about. This is what's being touted as an overreaction. This is what the overreaction, it's not an overreaction. This is what the overreaction is all about, trying to keep the healthcare system capacity ready for everybody that gets sick. It's not that this is killing 90% of people. Why aren't healthcare facilities like Cahaba Medical Care closing? Why aren't the hospitals closing? Don't get me wrong, we're taking major precautions with our masks and our protocols and our attention to hand washing, and but we're an essential part of not overwhelming our hospital systems and deploying testing when we get it. Testing has been delayed Testing has been delayed. It's been out of our hands. But we are an essential. We're a part of the essential front lines, so we are open, and we need our employees to be educated, calm, prepared, and ready to serve you. And we want you to trust that we're here to serve you. A word about what to expect over the next few weeks. I mentioned testing. Testing was not available in Alabama in any significant capacity until Friday, March 13th. As of this morning, March 18th, the testing that we did on Friday has not resulted yet. What that means is the statistics that you're hearing about, 3 cases here, 1 case there, 5 cases here in Alabama, prepare yourselves for exaggerated misinformation if it's not in context. The number of cases is going to explode. The number of cases is going to explode primarily because we've had a backlog of testing. People have been getting sick over the past week or two. We just haven't been able to definitively confirm that it is, in fact, COVID-19. So you're going to hear in the news, maybe tonight, maybe tomorrow, maybe next week, that Alabama has 100 cases, 5,000 cases. I don't know what the number is going to be, but I do know that some of that is going to be the backlog. You don't need to panic. We don't need to overreact, but you do need to take it seriously. This is real. We really are trying to do right. In the 21st century, we know how to deal with a viral respiratory pandemic. So we need to work the process. Everybody needs to be a part of the social distancing, the avoiding handshakes, and cleaning your workstations and washing your hands. And so this number is going to explode. And one or more of us in each of our communities that I'm talking to on the Cahaba Medical Care YouTube channel or Facebook, wherever you're watching this, one or more of us in the community is going to have this virus within the next few days. Some employees at Cahaba Medical Care, it's likely, given the number of employees we have now, somebody's going to have the coronavirus. It's going to happen. Nobody needs to panic. It's already been here for a few weeks. It's already been here. We're just finally now able to test it. And we have been practicing this safe respiratory virus procedures. People have not been coming to work sick. We've been wearing masks. We've been putting masks on sick patients for a long time. Everybody participate. Washing hands, not coughing into your hands, not touching your eyes, nose, mouth, cleaning and disinfecting your surfaces, staying home when you're ill, and avoiding close contact with sick people, and doing the Mike Pence elbow bump, the namaste, the wave, or just not touching hands. So what is Cahaba Medical Care doing? How and where do you get tested? We do have tests now. If you have a cough, a fever, a shortness of breath, we want to see you. We're prepared for you. We're prepared to keep you safe, our employees safe, our other patients safe, using an abundance of caution. Over the weekend, so many of our nurses and our physicians and our staff spent the weekend, I'm talking about early morning hours, late hours. We opened up 2 brand new temporary clinics. We retooled our community center, the old Cahaba Medical Care office in Centerville, as a fever and cough clinic. It's very safe. If you come in with a fever and a cough, you're going to get a mask. Our employees in that clinic are in masks and gowns. If they're going in the room, they're going to be wearing this eyewear. If they're in the hallway, they've got just the masks on. We've got another location in Birmingham in our West End clinic at 1308 Tuscaloosa Avenue. We have a separate waiting room. We've closed down the specialty clinic that was there. We're doing that by telemedicine, and we've made it a fever and cough clinic that has a separate entrance. We are checking the temperature and symptoms of every single employee every single day in this COVID-19 era to make sure they don't have a fever before they come to work. And we're doing testing. We've got appropriate amount of starter testing now, and by tomorrow morning on Thursday, we're supposed to have a lot more testing. How much, we'll see, but we should be able to test everybody that's sick this week, and hopefully eventually be able to test anybody that wants it. We are not there yet. We're not ready to be testing upon patient request. We also have, if this is an appropriate option for you, for the past 2 years, we've been doing e-visits. on a cash pay basis. Many of your insurances have emailed you and said, we are paying for e-visits, Blue Cross, Medicare, Medicaid, other insurances. So we have increased the number of our providers that are ready for e-visits. And so if e-visits are right for you, check that out. Obviously, we can't listen to your lungs or check for COVID-19 over an e-visit, but if you need something else and that's the right option for you, please do it. Please know all of our other clinics are still open for business. All of our other clinics are open for business, ready for any of your well care needs, your chronic disease needs, and we are trying to get our fever and cough patients in appropriate, safe places as well. A word about grace. This is a busy time, a scary time. We've prepped our employees to be ready to patiently answer your questions. You may be nervous. I don't think our wait times are any longer than they normally are on any given day, but just have grace, as our staff is understandably nervous and learning about this pandemic, but is showing up to work to serve you. Let's have grace for each other. We are your community health center and are happy to be serving. What if you have a question that wasn't answered? What do? Get on an e-visit. Come see your doctor. Let us know what questions we can answer. Keep these links on hand. The CDC has a great coronavirus website. The Alabama Department of Public Health has really been doing a public service for us. That Johns Hopkins coronavirus map is awesome. I click on it all the time. We have a website. We're going to try to keep you up to date. Each Cahaba Medical Care site has its own Facebook page. If you want up to the moment, up to the day updates from your site, make sure you're following your primary care physician's site, and we have a corporate Facebook page as well. Our residency does, our dental clinics do. Thank you so much for taking the time to watch this video.